angle it 15 to 20 degrees. And my central ray is going to be perpendicular to the patellofemoral joint space. That right there. I can then collimate in a lot more than I was doing previously. This is going to be a little closer to an 8 by 10, maybe even a little bit smaller than that. And then I'm still going to take my right marker, put it in the field, and she is still shielded. Okay. Hold still, Kayla. For this technique, it's going to be a little bit different. I'm going to be using 70 kVp at about 6 mass. All right, Kayla, hold still. X-ray. Beep. So the image here is going to be our tangential projection of the patella and patellofemoral joint. So for me, I used the Settegast method on my patient. So what I'm looking for in my image here is that there's evidence of proper collimation, so it's tightly coned in. We want to make sure we see that patella in profile. Also the femoral condyles and intercondylar sulcus. And we want to see the open patellofemoral articulation, so right here, the space. And then finally, we want to make sure that there's good detail in our image. All right, so for this next view, I'm going to be doing an intercondylar fossa. The method I'm going to be using is the Beclaire method. So for this one, I need to kind of elevate her knee upwards. I want to get about 60 degrees of knee flexion. So I'm going to put these pillows. Kayla, go ahead and lift your leg. Put these pillows underneath your leg, and then I'm going to put the IR right underneath that knee. Try to get the 60-degree flexion, so go ahead and bring it like that. So, because I have 60 degrees of flexion here, or just about, I'm going to also do that with my tube. So for this one, I'm going back to collimating to a 10 by 12. So I'm back to a 10 by 12, and my central ray is perpendicular to the long axis of her lower leg, entering ½ inch below her patellar apex. Perfect. And then I'm still putting my right marker on there. Good. So for my technique for this one, it's going to be 70 kVp at 6 mass. Okay, hold still, Kayla. X-ray. Beep. And relax. Okay, so here we have an image. It's our AP axial projection of our intercondylar fossa. For me, I used the Beclaire method. So some criteria when I'm looking at this image to make sure it is a good image is I want to see the open intercondylar fossa, which is this space right here. I want to see the posterior inferior surface of the femoral condyles, the intercondylar eminence, and knee joint space. So here's the eminence right here. And then no superimposition of the fossa by the apex of the patella, which we got here in our image. There's no rotation, and that's demonstrated by the slight tibiofibular overlap. And then we still want to see the good detail in the image as well.